Now let's discuss it from the basics. So usually what happens is, in the catecholamine is released from the adrenal glands. So this catecholamine will act on two receptors which are called as beta 1 and alpha 1 receptors. So beta 1 receptors are responsible to increase the cardiac output, and this will increase the BP, whereas alpha 1 receptors, they will act upon the smooth muscles and they will cause the vascular constriction. So this will increase the peripheral vascular resistance, and simultaneously this will lead to the increase in the BP. So next this is how catecholamine release will cause increase in the BP. So coming to the other cycle, whereas from the kidney there will be secretion of the thing called renin. Renin is released from the kidneys, and these are responsible for the conversion of angiotensinogen to angiotensin 1, and then simultaneously angiotensin 2 is released. This angiotensin 2, it will lead to the same process by acting on the smooth muscles and causing vascular constriction, increasing the vascular resistance and increasing the BP. This angiotensin 2 receptors, they will also act on the renal tubules, and they will increase the aldosterone, secretion of the aldosterone. This aldosterone, this will increase the absorption of the sodium. This sodium will, the water will also follow the sodium, and there will be increase in the blood volume, and hence there will be increase in the BP. So, and also renin, it will also act on the beta 1 receptors, and they will lead to the increase in the BP. So this is how this function goes. Next, now we will talk about what are the alpha 1 blockers, what are the beta blockers. Alpha 1 blockers, they are nothing but doxazosin and prazosin. These, if you can see here, these alpha 1 blockers, they will act on the smooth muscle, and they will lead to the increase in the vascular resistance and increase in BP. So alpha 1 blockers will lead to the decrease in systemic vascular resistance, and hence there will be decrease in the BP. Next, coming to the beta blockers. In beta blockers there are two types, which are selective beta blockers and non-selective. The selective beta blockers, they will act on the beta 1 receptors, and they are atenolol and metoprolol. So if you see here, the beta 1 receptors, they will increase the cardiac output and they will increase the BP. So by blocking the beta 1 receptors, there will be decrease in the cardiac output, and hence there will be decrease in the BP. Whereas coming from to the non-selective beta receptors, they act on both beta 1 and alpha 1 receptors. They are nothing but labetalol, and carvedilol, and you can also add propranolol. These three, they decrease the cardiac output, and they also act on the alpha blockers and cause decrease in the systemic vascular resistance, hence decreasing the renin secretion, decreasing the angiotensin 2, decreasing the aldosterone levels too. Hence this will decrease the overall cumulative decrease in the blood pressure. Now let's move on to the side effects caused by the alpha 1 and beta blockers. So in the alpha blockers, the side effects include hypotension and decrease in the total cholesterol, and this inhibits the adrenergic activities. Next, going to the beta blockers. The side effects of the beta blockers are bradycardia, as they are also acting mainly on the heart in the beta blockers of the heart. So bradycardia, there will be fatigue, hypotension, decrease in the libido, impotence, and bronchoconstriction. Beta blockers are contraindicated in the cases of peripheral vascular diseases and also in the cases of obstructive lung disease. So this is the part 1 of this lecture.